How am I supposed to know the difference between vertigo and lightheadedness? How am I supposed to know what my dizziness means?
Hi, I'm Dr. Christina, a doctor of physical therapy, and I want to tell you today about what different types of dizziness mean and how they can be helped. In addition to being a doctor of physical therapy, I have experience working with vertigo and dizziness patients of different diseases. And I want you to know for yourself, if you experience dizziness symptoms, what that means. Okay, so if you experience dizziness symptoms that last for less than 2 minutes, maybe just a few seconds, and specifically it feels like the room is moving around you, all right, that is a hallmark sign of BPPV, all right, benign paroxysmal positional vertigo. That specifically has to do with your vestibular system, your inner ear canal. This can be easily treated with 1 to 3 physical therapy sessions, and you can be taught how to handle this in the future to prevent it from happening and what to do to nip it in the bud in the future. If that is not the type of dizziness that you're having, let's say your dizziness happens when you move from one position to another, all right? Anytime that you are lying down and you move to sitting up really quickly, anytime that you're sitting down and you stand up really quickly, all right? Either of those things leading to you feeling lightheaded, for lack of a better term, to do with positional hypotension. Okay, so you move from a laying down position to a standing up position, all of a sudden your body's having to pump a whole lot harder against gravity to get the blood all the way up to your brain, all the way down to your feet. All right, ways that you can treat that is drinking more water to fill up your arteries and arterioles to more full blood volume. And you can also talk to your physician about what to do about that, because there can be some medications that can be helpful for that. If your vertigo or dizziness symptoms instead feel more like, I just feel a little unstable, and especially when I'm in a crowded area around a lot of people, I feel a bit more off than if I'm by myself, or if I'm somewhere that has a lot of lights and a lot of visuals to look at. It just makes me feel off, okay? What that can be is issues with your vestibular ocular reflex, okay? Remember that vestibular system that we talked about a second ago that's in your inner ear? Well, it communicates, when it's working properly, with what your eyes are seeing. So when I turn my head to my right, my eyes see that, my inner ear says that, so they agree with each other, and I don't get dizziness or vertigo. But when the visual is distracted, or the inner ear's having issues and they're not communicating correctly, that can lead to feeling dizziness, especially in crowded environments, visually stimulating environments. And there are specific exercises you can do to help with that and to prevent it from happening. Lastly, if you feel like the dizziness that you're experiencing happens more whenever your eyes are closed, or let's say more when you are on an uneven surface, this just means that we need to work out your other systems that regulate your balance. Balance is made up of 3 things: what you see, what you feel on the bottom of your feet or on whatever body part is touching a surface, and based on your inner ear. When we take away one of these things, it just means we need to work the other, kind of like we do an exercise to work a muscle. We can work any of those things as well. So, like I said, if you're not sure after watching this video which of these is your issue and you are dealing with dizziness, please reach out to a physical therapist, a neuromuscular expert. We would love to do an evaluation and make sure that you get a personalized diagnosis.